Welcome to this educational program.
This module discusses meniscal injuries in the knee. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. This material is independently produced, and the mention of any drug or medical product does not imply its endorsement. Menisci are the shock-absorbing cartilage cushions in the knee. They are commonly torn, either by an acute injury or by wear and tear over time. Treatment, by debridement, or by repair is generally very successful. To better understand meniscal injuries of the knee, let us review the important anatomy. This is a top-down view of the top of a tibia or shin bone. The top of the shin bone is called the tibial plateau. As you can see, the bony structures are covered first by articular cartilage. On top of the cartilage are the shock-absorbing cushions called menisci. There are two menisci, a medial and lateral meniscus. The menisci are C-shaped fibrocartilaginous structures with bony attachments at the front and back parts of the tibial plateau. The remainder of the medial meniscus is firmly attached to the joint capsule. The lateral meniscus is also attached to the joint capsule, but not as firmly as the medial side. The menisci are made up mostly of collagen. They are microscopically arranged to help absorb load and to prevent tearing. Despite this, excessive loads can cause damage to the menisci. The blood supply to the menisci determines its ability to heal after injury. By the age of about 10 years old, there is only good blood supply to the most peripheral 10 to 30% of the meniscus. The area with good blood supply is commonly called the red zone, while the rest of the meniscus is called the white zone. This poor blood supply is the main reason why most meniscal tears have to be debrided, which means removing bad tissue or foreign matter instead of repaired. Without a good blood supply, the meniscal cells cannot repair themselves. Debridement of meniscal tears does, though, provide very good symptomatic relief for most patients. You may be wondering why it is important to have menisci in your knee. The menisci play important roles in the biomechanics or movement of your knee, including load sharing, shock absorption, helping with stability, increasing congruity, meaning the relationship between two things and the contact area, limitations of extremes of flexion and extension, joint lubrication and nutrition, and helping you know where your knee is in space. This is also known as proprioception. In the past, meniscal injuries or tears were treated with complete removal of the meniscus. Unfortunately, this resulted in unacceptably high rates of early disabling osteoarthritis of the knee. This spurred the current trend of debriding only the torn piece of meniscus or repairing the tear. Meniscal injuries are very common. About 60 out of every 100,000 people will have a meniscal injury. Meniscal injuries are more common in men than in women. Traumatic tears of the meniscus generally occur in people younger than 30 years of age. Degenerative tears typically occur in people over the age of 30. An acute meniscal injury usually occurs as a result of a twisting injury or hyperflexion event. Older patients with degenerative tears of their meniscus often cannot recall an acute injury. Rather, they often have some degree of arthritis and sustain wear and tear injuries to their meniscus. Your doctor will conduct a thorough history check, perform a physical exam, and review special tests to determine if you have a meniscal injury. At the time of injury, you may have acute pain and swelling of your knee. As you recover from the acute injury, you may have complaints of locking or catching of the knee. You will likely also have continued sharp pains on either the inner or outer aspect of your knee. These pains are likely worse when squatting or climbing stairs. The pain is often caused by catching of the torn piece of meniscus by other structures in your joint. If your knee won't fully straighten, this becomes a more urgent problem and you'll need surgical consultation within 2 to 3 weeks from time of injury. Sometimes, a displaced torn piece of meniscus will dislodge and form a mechanical block to full extension of your knee. This needs to be surgically managed to prevent long-term stiffness of your knee. Your surgeon will check your range of motion, palpate, or feel your knee, and perform special maneuvers. Your surgeon will also assess the stability of the ligaments in your knee. This is because the high rate of associated ligamentous injuries with meniscal injuries. Sometimes these tests are painful, but it is important to ensure the correct diagnosis. Your surgeon will also watch as you walk and may ask you to squat on the floor. Plain X-rays will be performed to ensure that there are no fractures or evidence of arthritis that may account for your symptoms. An MRI may also be performed to look for evidence of meniscal injury. MRI is important, but not crucial in establishing the diagnosis of meniscal injuries. Several studies have reported up to 98% accuracy for MRIs in correctly diagnosing meniscal injuries. There are many different types of described meniscal tears. Examples, as shown here, include vertical longitudinal tears, oblique tears, degenerative tears, transverse tears, and horizontal tears. Not all meniscal injuries require surgery. Some meniscal tears are not symptomatic, and as such don't need to be surgically treated. Some meniscal injuries at the extreme periphery of the meniscus may heal without surgical intervention. These injuries are in the red zone. After your doctor has confirmed you have a meniscal injury, she or he will maximize non-surgical treatments such as activity modification, rest, pain medications, and physiotherapy. Often, though, surgical treatment is the best option for dealing with meniscal injuries. Arthroscopic surgery is commonly used to perform surgery for meniscal injuries. Treatment generally consists of debridement or removal of the torn piece of meniscus or repair of the torn piece of meniscus. The decision to remove versus repair is based on the surgeon's assessment of whether or not the tear has enough blood supply to allow proper healing. Meniscal injuries are very common and can be very debilitating. Meniscal injuries can be acute or degenerate over long periods of time. Some meniscal injuries do not need surgery. However, many meniscal injuries do need surgery. The decision to remove versus repair is based on the surgeon's assessment of whether or not the tear has enough blood supply to allow proper healing. Together, you and your surgeon will decide if arthroscopic knee surgery to deal with your meniscal injury is the most appropriate next step. This slide lists some of the many resources available where you can find more information about meniscal injuries in the knee. These current references were used to assist in the preparation of this module. All of these are available through your local medical library or the internet if you are interested in more detailed reading on this subject. We sincerely hope that this module has furthered your understanding of meniscal injuries of the knee.
We wish you the best for the future, and thank you once again for viewing this educational program.